Hi there, it's Laura from Laura Wamwell Photography, and joining me today is Dr. Renee Fleming from the Guelph Animal Hospital. And if you are active in the Dogs of Guelph group, I am sure that you have seen her wonderful advice all over Facebook. Welcome, Dr. Fleming. I'm so excited to have you here today.
Great. Thanks, Laura. It's nice to chat with you today.
So I know you've been a veterinarian for quite some time. How did you get started in veterinary medicine?
I graduated back in 2004, so about 17 years in clinical practice. When I first started out in university, I actually thought I wanted to be a physician, so a medical doctor. And then I kind of just one day changed my mind a little bit. So I don't have that typical, veterinarian dream where I've wanted to do it since I was a little kid. I think I was very open to doing anything in the medical field. I studied biomedical science at the University of Guelph and graduated and then went into vet school. So I think looking back, I'm really glad I made the decision that I did. I love what I do, and I know I'm really lucky to do it. So.
Perfect. So within veterinary medicine, do you have any particular areas that you're really interested in?
I do. So I've been practicing in regular clinical practice, but also as an emergency veterinarian, basically since graduation. So I do like emergency and critical care medicine. My area of professional interest is pain management. So I do hold an advanced certificate in pain management in pets. So both acute and chronic and perioperative pain in dogs and cats and small mammals. And then mostly because of the pets that I own myself, my husband and I have always owned bulldogs. Definitely, rolling with that, I become very familiar with the breed. So I do see a lot of short-faced dogs in my practice as well.
Nice. I noticed your lovely bulldog necklace there.
Yes. Yeah.
Oh, great. So what do you like best about being a vet?
There's so much. I mean, it's certainly the profession has its challenges, but what I really like is the diversity. So, from puppy and kitten visits, meeting owners and their families, helping them, educate them about how to best care for their pets so that we can share a lifelong relationship. I do enjoy the critical cases and, some of the tricky medicine that goes along with it. And then surgery, it's so nice because with my profession, you can do dentistry, you can do soft tissue surgery, you can do orthopedic surgery. So it's really varied. So every week is different in my practice. Every day is different. Even though we have a set schedule, things still can be a little bit unpredictable. I quite enjoy that. And I do work as well, not very often anymore now that I've got kids, but I do work in emergency medicine. So I love those shifts because it can be 12 or 14 hours of just sheer chaos that you have to juggle. And it really keeps you on your toes. And I think it keeps your skills high. So.
Oh, wow. That sounds like a huge range of skills that you'd have to have. Are you required to do continuing education so that you're always brushing up on new techniques?
We are. It's only been in the last few years that our licensing body has made it mandatory for yearly continuing education. Their requirements are still very low. I think most veterinarians do over and above that, and certainly it's not done because it's mandatory. For us, it's professional interest. And so in my first few years of practice, I focused on just general medicine, and then now that I'm older and more experienced, then it allows me to do continuing education in the areas that most interest me. So a few years ago, I did hundreds of hours of continuing education in pain management, and then I went down and sat an exam to get my certificate in as a certified veterinary pain practitioner. So that was a really nice personal achievement for me. It just gives me skills to better handle chronic pain in my pets. So.
Wow. So with your pain management, is that for pets who have long-term ongoing pain, acute pain management, or both?
A little bit of both. I would say for the most part, it can be so hard for pet owners, even, being a pet owner myself, it can be hard for owners to recognize very mild signs of discomfort in our dogs and cats, and definitely in our small mammals. They just are wired to hide from us signs of illness or weakness. And so sometimes when owners seek pain management intervention, the patient actually has some degree of chronic pain management. So I would say the majority of my cases, even if in an owner's eyes, things may be relatively acute, they actually might be more chronic than they think. But I also really enjoy, the acute pain management cases. So I'm sure you've all heard of a dog that was playing at the park and then, yelped and tore the ligaments in its knee, unfortunately. And I really like perioperative pain management. So if I'm planning a limb amputation, unfortunately, or, a large tumor removal, I like to think ahead for that patient and try and tackle, the pain on different levels, so that when I send them home to their owners, they're comfortable. There is pain associated with procedures, but if we plan ahead and treat appropriately, the animals don't feel that. And then we get them home and on their feet quicker.
Perfect. That sounds like a big responsibility, but it's nice to have you guiding the owners through all of that process. Um, what are some of the more difficult parts of being a vet?
I mean, there can be really challenging times when we have a pet who is injured or ill, and there are some, financial limitations of the owner for being able to treat. It can be very emotional for us, not just veterinarians, but everyone in the clinic, as well as the owners. And I think these days, with how common social media posting is, so your Instagram and your Facebook and whatnot, when people are frustrated or irritated by their veterinarian, they go online and they post about it. So they may have had a bad interaction with their veterinarian, things may have been recommended that were unaffordable, and owners sometimes feel very strongly that we overcharge, or we're just doing it for the money. And then you see these things online about your practice or yourself or your peers, and it's just getting hard to shake that off these days. That's quite challenging for sure. And then, certainly, it's very hard helping owners say goodbye when the time comes. So when their, pets are aging or unwell, trying to be a coach for them. So both an advocate for the patient and the patient's needs, but, also being respectful of owners' wishes, and that's another really challenging part of my job for sure.
Yeah. So if there were one thing that the general pet parent community could understand better about veterinary medicine or about the job of being a veterinarian, what do you think would help improve that relationship?
I think I wish people really truly understood, and many do, but when we do a recommendation for your pet, it is coming because we care about your pet and we want them to have the best. I will always make recommendations for my patients based on what I think is appropriate for their needs. Also remembering that I'm a pet parent myself, and I would never want to, short sell somebody the best quality of care. Also recognizing that when that's not possible, so if there are financial limitations, we can work together to make something happen. So, if I recommend X treatment and it's really outside your budget, let's see if there's a way we can work together. I think sometimes owners look at, the bottom line of a treatment plan and just think, oh gosh, like all my vet cares about is making money, and they're trying to upsell me and, sell me this bag of food just for the money. And it's really not like that. Every patient of mine, I care about them. I care about their families. I want them to be healthy. And I'm making recommendations because it's what your pet needs.
Mhm. So encouraging that ongoing communication is so important.
For sure. And we do see, I mean, I know you've seen it on the Dogs in Guelph page, people posting because they're upset, their vet quoted them XYZ and they're looking for somewhere cheaper. And there's always, cheaper veterinary clinics out there. And it really comes down to what is most important for you. I think you should have an open dialogue with your vet. And so if you have a negative experience with your veterinarian, to me, the first place you should be, going back to is that hospital, call, ask to speak with the vet, ask to speak with the hospital administrator, see if you can work something out. Because I think so often people get upset, and maybe there just hasn't been time for open communication, because maybe on that day the veterinarian had lots of emergencies and they seemed short and they seemed curt, but it's not because they don't care. It just was the nature of the day. So I'd much rather try and troubleshoot a situation with a client, and knowing that there's so many clinics out there. Guelph is amazing. We have so many amazing veterinarians. And so if a client and I don't, we're just not on the same page of things, I think that we can find another hospital that is better suited for your needs. In relationships, not everybody gets along, and it's going to be the same way in a professional one too. So I think you should always have trust in your veterinarian. If you don't, have a chat, and then, maybe there might be a clinic that might be a better fit for you. So
perfect. That is fantastic advice. And speaking of fantastic advice, we have some questions from the group that they would love to ask you. So I'll go ahead with these.
Okay.
So one question that came up quite a bit was, with the weather being so cold these days, and pets not being able to have the normal long walks or outdoor stimulation that they would normally have, what are some ways that pets can get the exercise that they need inside where it's warm?
It's tricky for sure, because it's very cold outside. The past couple of days has been really bad too. So for my guys, when they don't want to go for long walks, I have 2 English bulldogs, and they literally will put on the brakes if we get further than around the block. So we happen to have a stretch in my house in the hallway where I can toss a ball or toss some treats and just have them run back and forth. There are kind of mental stimulation games that you can get for pets. So there's definitely tons of stuff on Amazon and in some local pet stores where there's treat feeders where you can kind of trick your pets. And so it's not exactly the same as the physical activity, but at least keep their mind moving. I know some people sell snuffle mats, which is kind of cool, because you can put treats in there and they can work away at it. But just trying to find something within your house, you don't have to have a kilometer stretch for them to run. If you can just kind of keep them running short distances and get their heart rate up a little bit, can be helpful.
Excellent.
Mhm.
Somewhat on that note, we had one person who is wondering, is there a good way to help your cat to lose weight?
For sure. It's really tricky. I know. I once had one heavier kitty and 2 slimmer kitties, and it was really hard to kind of keep their feeding separate. So exercise for cats is definitely tricky. Some cats are very play motivated. So whether you have like a feather on a string, or like little balls, or I know some people use tinfoil to toss, something that the cat can go chase. If your cat is kind of lazy about that, I will throw treats down the stairs for them. So sit at the top, throw treats down. The cats can run down and get the treats, and then you can vice versa. There are little treat balls that you can put cats' food in. So you can put their kibble in a little ball and pop them in a room, and then they have to bat the ball around to get the kibble to come out. So that can be really helpful. In way of feeding, so if you happen to have a multi-cat household and you have one kitty that is on a special diet, so it works for like a medical prescription diet, or if you're trying to restrict calories, you can actually get bowls now that will open and close based on your cat's microchip. So, say you have, a chubby kitty who's on a prescription diet to help with weight loss, the bowl will only open for that pet. And if you have another pet, it won't open for that cat. So it can be nice. It can make sure that your pet is only getting the calories that they need and not borrowing off the other cats in the household.
That is amazing. I had no idea pet food technology had come so far.
It's neat. Yeah.
um, Tying into kind of the strange year that we've had with a lot of folks bringing home new pets, do you have any tips for dealing with separation anxiety as people go back to work?
Yeah, I think we do worry that this is going to become a bigger issue as people do start going back, whenever that may be. So as people have brought home new puppies right now, I do understand it is the perfect time for some families, because if you're home, it's easier for house training. We still encourage crating. I think crating is important whether you're home or not. Crating can really help diminish anxiety in puppies. And if they're already used to it as they're young, it's not like you're introducing it when they're a year and a half old, now that you're going back to work. So for example, my two dogs, my youngest is about a year, my oldest is about a year and a half, and they will quite happily sit in their crate for hours, even if my entire family is home and moving about. They're very comfortable there. That's their safe place. So I think that can be really key. If you happen to have not started crating and you have a puppy that might be, approaching a year old with this pandemic, certainly maybe ask your vets for some resources on how to safely introduce a crate. I certainly don't want to recommend that you stuff your dog in it and just, go, because that's going to produce some anxiety. But I think crating can really play a big role. And again, I tell my clients, like, if you're at home working from the computer, pop your dog in the crate for a few hours. They know you're home, but it'll get them used to that. And then when you do leave for work, they're happy and comfortable in their crate.
Excellent. So also about new pets, and I know this question is sometimes contentious on social media. We had a question about what is the best age to spay and neuter your pets?
Yeah, it's definitely an interesting topic right now, and in the veterinary world as well, we're a little bit split on our current recommendations, and it's not because we're confused. It's just there's kind of a lot of new research coming through. So our clinic recently contacted the University of Guelph, the Department of Threogenology and Reproductive Medicine. They are saying still, if you have a female, no matter the breed, so small to big, they do recommend spaying prior to the first heat. The risk there, if we allow a dog to go through a heat cycle or multiple heat cycles, the risk of breast cancer becomes much higher, and breast cancer can be malignant in dogs. There are some studies suggesting that for male dogs, especially some of the larger breed dogs, there may be some benefit to waiting until they're more full grown. So, if possible, we like to try and wait until 18 months to 2 years for some. The smaller the dog, they grow quicker, so we can neuter them a little younger. But currently, our recommendation for all breeds is before the first heat. We certainly work with owners. So I have some owners of female large breed dogs who just really would feel more comfortable waiting until they're after their first heat. And that's okay. We can do that. We just always check as they grow. We make sure that if we see any lumps on the mammary chain, that we take them off at that time, so that there's no problems moving forward.
Wonderful.
I think at the end of the day, there maybe is no distinct right or wrong answer. It's just trying to use the information we have at the time to make the best decision for our pets. A few decades ago, a lot of vets were recommending waiting until after the first heat. And it actually, even though there's an increased risk for your pet, so if they've gone through the first heat cycle, the uterus has more blood supply, it's more vascular, there's some risks during surgery, but it's actually easier from a surgeon's perspective to identify it and take care of it. So there really wasn't a whole lot of scientific basis back then for letting them go through a heat cycle. So I'm still recommending before the first heat cycle for females.
Excellent. And again, going back to all those new pets, folks are wondering, what are your feelings about pet insurance? Is it worth the investment?
Yeah, that's a good question, and I like to hear people talking about pet insurance. And so I think in an ideal world, if you are very diligent and can set aside a savings account for your pets and save, then the money is yours in the event that you don't need it. The downside, I will say to that, is sometimes your pet needs care before you've been able to save up very much money. So one of my clients had a puppy that had a foreign body surgery and had some complications, and I think her bill at the university was around $20,000. And so the pup was still quite young. I think no matter how diligent you are at saving, that's a huge chunk of money. And I think the puppy is alive today because the owner had the foresight to get pet insurance. Something I educate my clients. So I am a practice owner. So the care I provide for my own pets is taken care of in the hospital, but I insure all of my pets. I have 2 cats and 2 dogs, and I do insure them. My guys have ended up at the university for different things, and it gets very expensive quite quickly. And I just want the peace of mind to know that I don't have to make any decisions about their medical needs based on finances. So I do really think it's important for most pet owners to consider insurance. Yeah.
Yeah, that's wonderful advice. And I think, being able to make decisions about your pet's health without finance being the foremost issue that's the deciding factor really probably takes some pressure off of people.
I think so. Absolutely. Yeah. Just knowing that, some of that money is likely going to come back to you can be really reassuring for families.
Excellent. So we've talked a lot about what folks in the group would like to know. So let's talk about you for a minute. So who are your current pets?
So I have two English bulldogs. My bullies both came to me from breeders looking for good homes for them because they had some medical needs. So I'll start with Hank. Hank is my just under 2-year-old English bulldog. His full name is Hank Dinosaur Jr. He is a real sweetheart. He's a big cuddler, and Hank has a cleft lip. So when he was born, he has a failure of fusion right here. So he's got a little snaggle tooth. Fortunately, he's not had any medical issues with the cleft. He's had to have a few of his teeth out, but he's healthy. He's happy. He eats kibbles. He's a good boy. Sunny is my other English bulldog, and her full name is Sunny Skywalker. She had a full cleft palate. So I raised Sunny from the time that she was just over a week old, tube feeding every couple of hours. And she's been definitely a medical challenge. So she's had to have a number of surgeries on the top of her mouth to repair that cleft so that she can eat kibble and drink water like other dogs. She's a good girl. She's very healthy outside of her cleft. So that's Sunny. And then we have two cats, Ernie and Gordy. Ernie is an American short hair, so like a gray silver tabby. And Gordy is a little black and white tuxedo cat that came to me through Ladybird Animal Sanctuary. He was a stray cat on the streets of Hamilton. He had been hit by a car, and unfortunately we weren't able to save his leg. So I had volunteered to do the surgery for them, and I just fell in love with him because he's such a sweetheart. So that's Gordy.
Oh, nice. And the cats and the dogs get along all right?
Very well. Yes. Yeah. They all get along very well. Sunny, my puppy, the youngest one, she sometimes will chase the cats a little bit, but they can get out of her way quite easily. The cats are quite fast. So, and sometimes you come home and I'll see one of the cats curled up in the dog bed with the dogs. So they do love each other very much.
Now, because you have a cat who has 3 legs, does the cat need any special accommodations, or does it keep up with all the other pets just like normal?
He's amazing. And so there's a saying in the veterinary industry that most dogs are born, dogs and cats, with 3 legs and a spare. So luckily for our patients, when the need comes to do an amputation, most times they do very well. Most people who see Gordy don't notice that he is 3-legged because he walks so well. And in fact, Gordy will be the first one up the Christmas tree when we put it up. He also has this really cute habit. He likes the kids' mitts and gloves. And so at night, you can hear him carrying mitts and gloves up the stairs, and he chirps like he's hunting. And so sometimes when my husband and I wake up in the morning, there might be 7 or 8, miscellaneous gloves and hats at the top of the stairs that he's carried up there. So it certainly, it doesn't slow him down that he's 3-legged. As he ages, definitely I'll want to make sure that he's not developing osteoarthritis, especially with the back leg bearing the majority of the weight. And we try to keep him very lean so that there's no, excess weight on the rest of his body.
Wonderful. So what is your favorite thing to do with your pets here in Southwestern Ontario?
My goodness, I think it's hard right now because you're not supposed to go anywhere. We really like to go, hiking, and having bulldogs, you do have to be careful because, they are prone to overheating. So we like to go in areas where there's lots of shade and there might be some, water available for them. And living in Guelph, we're so lucky because we have so many beautiful trails within the boundaries of the city. So admittedly, we tend to kind of stick to the Guelph Lake trails in the summertime, and, we'll take the doggos out there and let them, swim at the river and that sort of thing. So nice. Yeah, that's what we like.
Excellent. So I have a couple of fun little quick questions for you. Sure. So do your best, answer off the top of your head. So, cat or dog?
Dog.
Favorite breed?
English bulldog.
Obviously. What are your pet's favorite treats?
My dogs love greenies, love, love, love. And actually, to be honest, my cats love the greenie treats too.
Excellent. Are your pets full of beans, full of dreams, or full of something entirely different?
Definitely full of beans, all of them full of beans. Yeah. For bulldogs, these guys are pretty hyper.
Excellent. Um, which human actors would play your pets in a movie?
Oh my gosh. Um, I can't even that would take me a while to answer. I need to skip.
No worries. And finally, if money were no object and you could go anywhere in the world with no restrictions, what's one thing you would do to spoil your pets?
Oh wow. Um, to spoil them. I mean, it would be so lovely to take them somewhere where there was just like big open spaces to roam and water for them to frolic around in. Um, I can't think of where I would take them. All I can think about right now is that you shouldn't fly with English bulldogs. So I think sticking somewhere local.
Nice. Oh, that's excellent. Um, so finally, I want to wrap up. You are always so generous with your information on social media. So how is the best way for this local community to help support you and your practice?
Um, that's a tricky question, I guess. I think what I do want people to be aware of, and I'm cognizant of this when I comment on posts of dogs at Guelph, I really am posting or commenting because I want to help. I'm always happy to meet new people through my clinic, but I'm fortunate that I can often help people online as well. So I think I maybe less so about my business, but for veterinary businesses across, just remembering that your vet should really be your first place where you do ask questions. So yeah, if you need something, think about calling them first before reaching out on social media. I think that's important. There's a lot of well-meaning advice that gets shared on the internet, but sometimes things are maybe not appropriate, and it can be hard to sift through that. So yeah, just remembering that always ask your vet clinic first, and they should be happy to help you.
And remembering that vets love pets.
We do. Absolutely. Yes, we do. And I know it's hard right now with the pandemic because you're not in with us and you can't see what's going on. But I tell you, like, I'll go out and get a pet and bring them in for an appointment or for surgery. And they beeline to the front desk because they want to greet the girls there. And then they beeline to the treatment room because they want to see the technicians and the staff back there. I know there's, lots of discussion about, anxious pets and that sort of thing. But we really are trying to make it a real positive experience for the pets, and from my hospital team to everyone out there, we know sitting in a car in the cold parking lot is not what you want to be doing right now, and we're doing the best we can to muddle through. And we want to thank everyone for their patience and understanding as we all kind of travel through these really unique times. So
Amazing. Well, thank you so much, Dr. Fleming. It has been an absolute pleasure talking to you. And I hope that you have wonderful continued success in your practice. Again, thank you for being so giving with all of your information. I'm sure everyone here in the community really appreciates it.
it's no trouble. Thank you.
Well, thanks so much for listening. I'm Laura with Laura Wamwell Photography, here with Dr. Renee Fleming from Guelph Animal Hospital, and we both hope that you and your pets have an awesome day. Bye.
Bye.